Hello to everyone joining online. We'll just give it a couple of seconds for people to join us, and then we'll go through a bit of housekeeping and introductions before we start our presentation. Thank you. Okie dokie then. We'll get started, and then I'm sure more people will join us as we go. Just a bit of housekeeping from me. So the webinar will be recorded so that you can watch it back or share it around so people get a chance to see what we're working on. If you have any comments or questions, we've got the live chat feature, so add those as we go through the presentation, and we'll address them after each section. And just before we make a start, we'll just quickly introduce ourselves in the hybrid room. So we'll start on the screen. So John and Vaughan, would you like to introduce yourselves?
Hello, I'm John Dixon. I'm the Planning Policy Manager for the Greater Cambridgeshire Planning Service.
Hello there, I'm Vaughan Bryan, Planning Policy Officer here at the Greater Cambridgeshire Planning Service.
Thank you. And Katie?
I'm Katie, I'm Planning Policy Officer.
And I'm Lizzie Wood, and I'm Principal Planning Policy Officer. So, can we go on to our first slide, please, Vaughan? Here we are. So, welcome and thank you for joining this evening. An agenda that we've set out is to discuss why we prepared the 3 supplementary planning documents, and throughout the presentations you'll hear the acronym SPD. That's just so we can cut down on the number of words that we're using, or else we'll be repeating it an awful lot. We'll go through an overview of the 3 SPDs that we have drafted, the programme of work for the preparation of those SPDs going forward, the information on the consultation period and how you can respond to the consultation, and question and answers throughout the sessions. So on to the next slide, please. Why are we proposing the SPDs? So the 3 SPDs that we're consulting on at the moment are the draft Cambridge Biomedical Campus SPD, the draft Greater Cambridge Planning Obligations SPD, and the draft Greater Cambridge Health Impact Assessment SPD. And the purpose of these SPDs is to provide further guidance on the policies that are set out within the adopted local plans for both the City and South Cambridgeshire from 2018, and to support with the process for planning applications coming forward ahead of the Greater Cambridge local plan. The guidance will provide further clarity on the expectations of planning applications and development, and streamline the planning process, ultimately leading to a higher quality development across Greater Cambridge. More specifically to the biomedical campus that we'll talk about shortly, the purpose is to guide potential new development proposals on phases 1 to 3. Next slide, please, Vaughan. So a bit about the context for the Cambridge Biomedical Campus SPD. So within the adopted Cambridge local plan, the Cambridge Biomedical Campus was originally allocated as part of Policy 17 that set the area out as an area of major change, and our local plan policy aims to continue to support the high quality, sustainable development on the campus, including Addenbrooke's Hospital, and to meet the needs for the health and expanding needs within the city. Next slide, please. So again, the South Cambridgeshire local plan also identifies the biomedical campus in policy E2 and supports the expansion of the biomedical campus for research development and more employment growth. Next slide. Therefore, for the first proposals on the emerging local plan, we've continued to support the development and evolution of the campus, including the original site allocations, as well as exploring opportunities for the longer term development on the campus, and that's set out in the map on the right-hand side. That potential expansion of the campus is being picked up as a part of our work stream on the emerging local plan. So it's not specific to this SPD, but is in the works in the background of all of this. So now I'll move on to more focus on the SPD. If we can go to the next slide, please. So what does the SPD cover? As I mentioned earlier, an SPD provides further guidance on the policies set out in the adopted local plans and doesn't create new policy, but just guidance to help with the implementation of those policies. It sets out an update on the council's ambition for the campus and identifies high-level principles to inform further development, including through a framework for developers to consider when preparing their planning applications. Next slide, please. So the SPD sets out 6 key themes that contain development principles to consider when preparing those planning applications. In the preparation of the SPD, we did seek feedback from our local residents associations and parish councils to understand the key issues that were arising and how we could incorporate those into the SPD. So as a result, we've drafted these key development principles, and the key themes include open space, landscape, public realm, the built form, connectivity and movement, sustainability and phasing and delivery. And we really wanted to be clear in the document that our intention was to identify those issues and respond to them through design principles. So each section has an introduction to what those overarching themes really mean in context and in practice, and then sets out the particular principles to apply in your planning application. So an example would be for the key principle of built form. Principle 4C2 sets out the scale, character, materiality, and the nature of development that the planning application should consider. And development coming forward should seek to positively contribute to that user experience, not just for the patients and visitors, but people working there and the wider community, by providing that human scale building and improving the signage and legibility and creating that sense of character and place on the campus. As a result of these sorts of principles, when our development management colleagues are involved in the pre-application discussions with developers, or later on in determining planning application, they'll be able to read the SPD alongside our existing local plan policies and make those really informed decisions that are proportional to the scale, function, nature and location of the proposals coming forward. So this shows how important the document will be in the next phases of on the campus ahead of the Greater Cambridge local plan that we'll bring forward later on. So next slide, please, Kate. Vaughan. Do we have any comments in the chat so far? Okie dokie. Well, we do have a question that was sent in ahead of this event, and I will bring that up now, just so we know what they've said. So, this is one I can address. Obviously, I've just talked about the Biomedical campus, but feel free to chip in, Vaughan or John, online. The question is, has the SPD considered the impacts of development on climate change and the environment? So, throughout the development principles, we've tried to incorporate the environment as a key underlying theme, as it's such a crucial part of delivering high quality development. A particular part of the SPD is the principle of section 4A, which highlights the important role of open spaces and landscape, whilst also identifying opportunities to deliver for and consider ecology, biodiversity net gain, landscape and the key views from the campus. So under that section, 4E also seeks to support the use of sustainable and climate resilient development that considers appropriate design and construction and environmental health. So I think we really have tried to focus on those key issues around climate change and the environment within the SPD, and we'll continue to adapt our SPD wording to emphasise that later on in the process. Any other comments for this section? No, if you do think of anything, we're happy to take comments at the end if you're just digesting what we're talking about, so thank you. I'll hand over to the next part of the presentation. John, I think it's you.
So the second of the SPDs that we're currently consulting on is all about planning obligations, and for this section, you'll see a new face appear. I've been joined by James Fisher, who is the council's Section 106 officer. You may be wondering what Section 106 is. So I'm going to go through and explain what planning obligations are, why they're so important, why we're doing a supplementary planning document to support our local plans, what it covers, and things that might be of interest when responding to the current consultation. So I guess starting at the beginning, what is a planning obligation? Well, it's used by the planning authority basically to make an unacceptable development acceptable. So not to make a bad development good, but it makes sure that a development will respond to the infrastructure needs it creates in order that it can be granted planning permission. It's often referred to as a Section 106 agreement, and that's referring back to the Town and Country Planning Act of 1990. Effectively, they're legal agreements which set out at some length details such as what contributions or issues need to be addressed, when do they need to be addressed. Most of the planning obligations actually respond to policies in the adopted local plan, and therefore this SPD is supplementing that. You'll see at the bottom how important these agreements are. Every year we publish statements regarding how much money is brought in through the planning obligations process. And you can see in the year 2022-23, it brought in around 18 million for the county council towards things like transport and schools and the areas they address, and another 5.5 million to Cambridge City Council and South Cambridge District Council. So it's a very significant issue. These obligations effectively, again, are guided by the local plan. They are covered by lots of rules and regulations behind what's reasonable to require. For example, national policy requires them to be necessary to make a development acceptable in planning terms, directly related to the development, and fairly and reasonably related in scale and kind to the development. But there is quite a wide range of issues, therefore, those obligations can be used to address. Now, as James would agree, the Section 106 process is a lengthy one, starting from early discussions before a planning application is even submitted, through consultation with an awful lot of stakeholders, including parish, town councils, and so on, to determine what is necessary to serve the development in question. The preparation of the legal documents, starting with heads of terms about what it might cover, through to actual detailed legal agreements and the signing of the process. And then there's also then financial terms to be met. There's triggers for payments, and there's monitoring of those agreements to make sure what was agreed happens. And they can add a lot of time to the planning process. So one of the reasons we've worked on creating this additional guidance is to make the process as clear as possible for communities and the public to see how the system works, for developers to see what the councils are expecting and the process that we'll be expecting to follow, for organisations to be able to help provide a steer on how they will expect issues to be addressed, such as the county council, health authorities, for example, really to help us speed up and make as efficient as possible the planning application process and make sure those funds can be brought in as efficiently and effectively as possible. So next slide, please. What's in the SPD that we're consulting on? So we start off with an explanation of the process, and it goes over some of the points I've just covered. when might a Section 106 be required as part of an application? The technical details around the legal agreements, the range of local plan policies that could require a response through the planning obligations process. We then go on to the second chapter, which really almost walks through the process from start to finish, from when to get involved, when an applicant should engage on Section 106 issues as part of the pre-app process, what the consultation might involve in that, how we will work up what is required, where the templates will be available for those agreements, right the way through to how we will monitor and publish the information about those agreements on our website. Chapter 3 of the document then introduces really the remainder of the SPD. There's a wide range of topics covered by the SPD, and for each of those, the SPD provides the policy context, largely pointing to the adopted local plan policies, which this will be supplementing. It sets out the type and scales of development that may be required to provide a planning obligation on that issue. It sets out the form in which contributions may be required. So in some cases where the development is large enough, it could be the delivery of a facility or an improvement directly as part of the site, or in many cases, particularly as part of small developments, it may be seeking a financial contribution. It sets out who will be involved in working out what the needs might be. So, for example, that could be a liaison with the town or parish council to understand what projects are needed in order to support the needs generated by that development. Or it could be other bodies like the county council or bodies involved in health and so on. In coming up with those financial sums, often, particularly where you've got smaller sites, it simply wouldn't be practical for a small development to deliver, say, an entire new facility, like a new recreation ground and a new health centre. But those sites will still generate a need which cumulatively results in the need for a new facility. So what the document does is set out how we would work out what a reasonable contribution might be towards those sorts of facilities where there is a need, that can then be used to attribute a value and a starting point for negotiation on individual agreements. Each chapter also sets out what there might be exemptions. So, for example, are there types of development where for specific reasons we wouldn't ask for a contribution, unlike other forms of a similar kind of development? It also sets out where to find other guidance. That might be other strategies of bodies involved in that type of infrastructure. It might be, for example, the council's housing strategy. But we try to find or provide information where people can find more. So next slide, please. This really goes through the list of topics addressed by the SPD. I guess one of the most significant topics it addresses is affordable housing. So both councils' adopted local plans broadly seek a 40% of residential developments to be affordable, and the SPD provides further guidance on the form that will take, guidance on how that should be implemented, issues like tenure, phasing, and how the issues will be addressed in legal agreements. Again, building on the council's existing local plan and housing strategy, but setting out how that will be put together in a legal agreement. Then it goes through various topics like green infrastructure, open space, and so on, which for many small sites will be about contribute to off-site provision. So, for example, it could be pooling funds to allow, say, a parish council to secure some additional land. It could also allow the improvement of an existing facility to help meet the needs generated by developments, such as adding to a pavilion or improving the drainage of a pitch so it can supply more or provide more football games during the winter, for example. Many of the topics in here are those areas managed by other authorities, so particularly libraries, transport, education are operated in many ways by the county council. So we've worked with bodies like them to work out how they would seek their agreements, what they would look to negotiate, and how they work out requirements for things like school places, how they work through population to work out how many children development would generate, and so on, to provide clear guidance about what the expectations will be. We also pick up issues like public realm improvements, waste, making sure the right bins are provided to support new housing developments. We've looked at whether there are some more innovative ways we can support the creation of places really that support local people accessing the economy. So can we encourage developments to include skills plans where they might be able to provide apprenticeship opportunities as part of the construction process, or even as part of the longer term use of those developments. We've worked hard with our healthcare colleagues, so the integrated, I get the name right, the Cambridgeshire Integrated Care System, which really brings together a number of health bodies to try and capture exactly how we can secure contributions to make sure that health is addressed as part of new development. And finally, we pull together lots of other issues that could potentially lead to issues being addressed in the SPD. So we've not covered everything because there's quite a broad range of issues that can be addressed, but we've clearly provided pointers to other issues beyond these topics that could be addressed. So that really summarises what's in the SPD. We're interested in views as we draft the document on whether we've got the issues right, is there further guidance we could provide, and generally, is it going to help provide clarity regarding how we move Section 106 forward in this efficient and clear manner, supporting the developments meeting the needs that they generate. Thank you. I think I've covered that one now. Lizzie, back to you.
Thank you.
Great, thank you, John. We've had another question shared ahead of the presentation. Will this SPD supersede the existing Cambridge City Council Planning Obligations Strategy SPD from 2010?
Yes, it will. So there have been various forms of guidance which we've hoped to sort of draw together in this final SPD, which is again one of the reasons why we've done it. One of the documents that would be superseded was an SPD that was done back in 2010 supporting the previous city local plan. We've certainly reviewed that and drawn on elements of it, but we hope by drawing together everything as new SPD, it provides almost a sort of one-stop shop for developers to understand how we'll go through the process.
Brilliant, thank you. Do we have any more questions online? No. Alrighty then, we'll move on to the Health Impact Assessment SPD. Thank you, Vaughan.
Thanks, Lizzie. So the third SPD that we've looked at is the Health Impact Assessment SPD. So the environment that people live in can have a broad range of impacts on people's health and well-being. Broadly in physical terms, this covers a range of factors such as air quality, the risks of overheating in homes, the safety of roads, and the availability of healthcare facilities. But there are a range of intangible aspects of our daily life that are also related to health, such as feeling safe when walking through neighborhoods, perceptions and threats of crime, and having access to safe spaces in which people can interact with friends and family. So health impact assessments are methods of assessing the positive and negative impacts of a development proposal, but they also function as a guiding framework for the design and delivery of a development. So they often incorporate a range of qualitative and quantitative data. It broadly depends on the type of HIA that is pursued in relation and respect to a development, but we'll go over the types later on. and often includes a degree of community and stakeholder engagement to try and identify the health impacts of a proposed development. So if I move on to the next slide. So we have developed a Greater Cambridgeshire Planning Health Impact Assessment SPD. Health impact assessments aren't actually new. There is an existing SPD for South Cambridgeshire that was adopted in 2011. Officers have had a look and sought to introduce a new SPD following evolutions and refinements to best practice guidance on HIAs, and this includes guidance that was published at a national level by Public Health England in 2020 on the topic. But it's also been produced in light of best practice guidance that has been published by the London Healthy Urban Development Unit, or HUDU, who have produced various checklists and toolkits that the authorities in the Greater London area use to assess proposals of various types and scales, and to have a look at the health impacts of those prospective developments. So our draft SPD is designed to provide detailed guidance on when HIAs need to be considered as part of a planning application in Greater Cambridge, and who should perform HIAs, providing additional guidance on that. It's also been accompanied by a series of checklists and toolkits which have been integrated into the appendices of the SPD. These toolkits have been designed to help project teams and applicants assess the health impacts of their developments, but have also been designed to help frame any application or pre-application discussions with officers as well. So as a broad overview of the HIA process, detailed guidance on the procedural steps has been provided within the SPD itself, and the guidance that we've provided within the document has been adapted from the national guidance that's been published by Public Health England, and broadly adapts and evolves the guidance that is published in the 2011 SPD. So as a broad overview of the steps, in the first stages, you would have screening, which identifies whether an HIA would be needed in a particular case and for a particular development. The thresholds to help determine whether an HIA would be appropriate or not have been based on the policy requirements set out in existing local plan in the existing local plans. And the SPD also provides policy linkages to where the various aspects of health consideration is covered by existing policy as well. So in the event that screening does identify a development as requiring an HIA, and typically this is for larger scale developments of 20 or more dwellings or 1,000 square meters or more floor space. Again, as I said earlier, the type of HIA depends broadly on the scale of development being considered. But in the event that an HIA is needed, one would then go on towards the scoping stage to determine the extent of an HIA that would need to be undertaken, the types of data that would need to be ascertained, and the level of assessment that would need to be presented as part of a planning application. So this can range from desktop reviews, rapid HIAs, or comprehensive full HIAs, with desktop reviews being more akin to high-level appraisals of a development's impact, using secondary data and desk-based analyses of a proposal, whereas full comprehensive HIAs often involve extensive things like community engagement, stakeholder engagement, and additional qualitative data analysis on top of quantitative data analysis. To help frame that, a series of data resources have been provided within the SPD. So yeah, that can be used from there as well. In the first instances, we would strongly advise applicants and developers to engage in pre-application discussions with officers from the councils to help determine whether a screening opinion is correct, and to help scope out the an HIA if an HIA is required. So that's trying to scope out the methods, the community groups, and the people that should be considered, and the various range of health impacts that can be considered as well, from physical to mental health impacts, layout of spaces, etc. The checklist provided within the SPD at Appendix 3 is designed to help during the scoping and assessment and reporting stages of the HIA process. So they are there to help frame the scope of the study and how to present the study. And again, we would suggest that these toolkits are used to help frame pre-application discussions with the council's officers. And the range of topics that are assessed during the assessment stage of an HIA will vary depending on the type and scale of development that is being considered. So it's relatively difficult to say what would have to be assessed without having seen a development proposal, but the things that can be considered will range from promotion of healthy lifestyles through active travel infrastructure and sports facilities, the ability for people to engage in social interaction in open spaces, the impacts on air quality, the impacts on crime and the threat of crime, etc. And then finally, the SPD gives an overview of any post-decision monitoring requirements that could be secured through planning conditions or through Section 106 agreements. But again, the scale of that would depend on the scale of development being considered. Thank you.
Thank you, Vaughan. Do we have any questions online?
No questions online. A question we have been asked previously is, has the preparation of the HIA SPD considered the Cambridgeshire and Peterborough Joint Strategic Needs Assessment, and will it contribute to the needs identified by the assessments?
I'm happy to take this one, Vaughan, if that's okay. The answer is
go for it, John.
yes. So one of the recommendations coming out of the JSNA really highlights the importance of the HIA process. And what we've tried to do is to reflect the sheer range of issues that the Joint Strategic Needs Assessment picks up. Just for information, what the Joint Strategic Needs Assessment is a sort of a collective view by the bodies involved in health, particularly led by the County Council, on health issues facing the county and how they should be addressed. And one of those documents particularly looks at the built environment, and it was recently published, I think in the last couple of months. It's available on the County Council website, I believe. So we have tried to draw on that. I think the thing we've most drawn on in this update, though, is the London Hoodoo model, the Healthy London Development. So I'm going to get that acronym horribly wrong. So they really develop best practice. So HA isn't a new thing, and they've really built on that best practice. And I hope they kindly allowed us to look at some of their learnings. So I hope we've reflected that in our guidance and built on that with local issues as well, working with our health colleagues. But the consultation really is a chance for communities, developers, those organisations involved in health to tell us whether the HIA process is picking up the right issues. Is it going to capture everything we need to be doing? Are there more things it could pick up? Are there details that we've missed? We hope the consultation gives us the opportunity to look at those points.
Yeah, just to pick up on that as well, John. Yeah, you're absolutely right in that most of this was developed on the practice that was published by the Healthy Urban Development Unit.
That's the one.
But the JSNAs have been referenced within the SPD itself, within the resources. So they are there and available as context anchors, particularly for a lot of the HIAs that go on in the Greater Cambridge area. So they can be used to establish the context and the communities that may well be impacted. I think in terms of contributing to needs identified and aims, I hope you'd agree, but I think the SPD would be more indirect in that effect, insofar that it depends on the type of development that is being considered and thus being assessed by the HIAs. So they're more of a catalyst to help meet those needs and push towards better health outcomes by helping to direct development towards more healthier practices and a more broad consideration for social and cultural betterment.
Brilliant. Thank you, John and Vaughan. I think we'll move on to the next slide and the next section of the presentation about sort of the consultation information itself. So the consultation started on the 28th of November and is running until the 24th of January. And we really encourage you to submit your comments to the consultation so they can be incorporated into the further iterations of the SPDs. So from the end of the consultation period to mid-February, we'll be reviewing those comments, amending the SPDs accordingly to reflect all of that feedback that we've had. And then in March of next year, we'll be recommending the final versions of the SPDs for adoption both by South Cambridgeshire District Council and Cambridge City Council at the relevant meetings. So hopefully they will be adopted in March of next year. But before we get there, we've got a lot of events underway. So this Thursday, we have an in-person event at the Clay Farm Centre. All of the addresses and further information can be found on our website, but we'd really love if you could attend. Come along, have a cup of tea and discuss the SPDs, and we can help you submit your comments if you would like that, or we can give you more information on how you can do it yourself. And we also have two specific events for the Cambridge Biomedical campus, as it's a site-specific SPD. So we want to engage with our communities as much as we can who live in the local area or work nearby. So they're on Monday the 16th of December and Tuesday the 17th of December. Next slide, please. So if you can't make it along to any of our events, that's not a problem. You can still submit your comments on the SPD by using our online consultation hub through that web address. It's on our Greater Cambridgeshire Planning website, along with all of our social media, so there are links available online. But we also accept comments via our email address, which is localplan@greatercambridgeplanning.org, or by post to our PO box, or you can request a form to complete and return to us by either email or post. So if you would like to see any more information on the SPDs that we've presented today, please do go to our website or get in touch with us either via email, post, or at our engagement events coming up. Last slide, please, Vaughan. Are there any other questions or comments that we can answer today? Do get in touch if not, and we're happy to assist throughout the engagement process. Is there anything online?
Nothing online.
Okie dokie. Well, thank you very much to everyone who's attended, and the link will be available to share so you can watch it back and submit your comments afterwards. So thank you for your time, and we'll see you soon.